Hello, you guys. So let's talk about pain and the possibility that you're actually solving for the wrong issue. You're trying to solve symptoms, but the pain, though very real, might not be the problem. It's actually the messenger. A lot of the people that come into my clinic have spent years trying to treat symptoms. They stretch the sore spot, they massage the tight area, they try to strengthen their core, the weak muscles, and sometimes it works until often it doesn't. Or the pain moves, or it comes back, or it shows up somewhere else. And what if the reason relief doesn't last is because you're trying to solve for the symptoms instead of getting to the underlying pattern? So today I want to talk to you about patterns behind moving pain and how you can stop chasing symptoms and start listening to the body differently. I'm Dr. Melanie Carlone, and welcome back to Why It Hurts and How to Heal. I've been a physical therapist now for over 40 years. I've got a master's and a doctorate degree in physical therapy. I'm also a 200-hour yoga instructor times 2, and I've been doing yoga since 1993. All of this has led me to really refine into somatic physical therapy and understanding how breath and a more whole health lifestyle can address the underlying causes for chronic pain. Because I work with people living with chronic pain, chronic inflammation, bracing in their bodies, undefined fatigue, stress overload, nervous system dysregulation. A lot of times people come to me, have tried everything, and they still didn't get better. And by honing in to some of the holes in their roofs that are causing the leaks everywhere and plugging each one systematically, people start to feel better. So today I want to unpack why pain moves, or why it stays in an area and doesn't seem to respond well to the treatments you give it, and what that might be telling you about the real pattern underneath it. So today I want to introduce my little buddy Pico de Gallo. This is Pico. And he is an awesome little dog. First little dog I ever had. We were all very nervous about a Chihuahua because they can be little tyrants, but he is the most chill dog. But when we got him, he was full grown, and he'd been living on the streets in Juarez, Mexico, and raised very lovingly, very well adapted. So not a lot of nervous system dysregulation, but somehow he fractured this leg. So you can kind of see there's this odd angle in this foot. And when we got him, he was a 3-legged dog. He kept this leg up all the time, and he was always limping. And he was also very inflamed. So you literally couldn't lift the tissue on his body. His fascia was so gummy and sticky from eating whatever it was he could get his mouth around in probably a pretty disadvantaged environment. And so he's a very lucky dog. He's on a raw whole foods diet and lots of good oils. And I've been working on his muscle tensioning and trigger points in his leg. And now, even though we have not changed the underlying angulation, the tendency for the ligaments to be out of place, the muscles are kind of deformed in here, we haven't changed any of that. But you know what? This dog doesn't limp anymore. Looking at the wholeness of this little beast, and also just his, can you tell he's pretty chill? Just his overall well-being and how well adjusted and adapted he's become in this home. He literally doesn't limp. As a matter of fact, he runs everywhere. So let's think about that a little bit more. We get these diagnoses and we kind of lodge into thinking that, oh, this is wrong with me or that's wrong with me. But thinking of the body in parts is just wrong, right? Oh, I have tight hamstrings. Oh, my glutes are weak. Oh, my neck muscles are always strained. But your body doesn't function in isolated pieces. It functions in coordinated patterns. As a matter of fact, there's trains of movement that go through the body. When your right shoulder tightens, your left hip responds. Think about it. When you walk, one arm comes forward, the opposite leg comes forward. So there's a pattern of motion there. When your jaw braces, it affects deep into the rib cage, right? If your pelvis subtly rotates, your spine has to organize around that. And that isn't dysfunction, it's compensation, it's adaptation. Your nervous system learns how to distribute what's load is being asked of it across the whole system to keep you upright and moving with the least amount of effort. But over time, that disequilibration, that misalignment becomes problematic. So if you treat pain just locally in one area, you may calm one node, one piece of the system, but what are you doing to connect the whole pattern together and treat it? Well, the connector for our body is our fascia. Fascia is that connective tissue web, and it's actually acellular. It's collagen and fibrin and different elements that don't actually have cells, but they're like a tissue matrix with structured and unstructured water permeating it. And it wraps every muscle, every organ, all of your vasculature, your arteries, your veins, your capillaries, all your nerves, your bone. It's like this three-dimensional tension network. And if you pull one corner of a spider web or a fishing net that's hanging, the whole web has to respond. So that's why a sprained ankle can really influence your back, or a braced jaw over time affects the pelvic floor. It's why pain migrates. But fascia doesn't just tighten randomly, it responds to load. And load isn't just mechanical, right? With Pico, the stress was also caused by what he was eating and chronic tension within the fascia from metabolites and built up of yucky, sticky stuff within the cellular structure in the fluid of his body. So that kind of inflammation matters. Sleep disruption, strain constantly in your emotions, or chronic vigilance from hyperactivity of your amygdala. So that's what is called allostatic load, like that cumulative burden of stress across many systems. And when that load stays high, fascia stiffens to protect you. Muscle tone increases. Your breath becomes more shallow. It's ready to react. Your body organizes around protecting you. And that fascia is going to transmit that force across the whole web. So what decides where the pain appears first, or where it keeps going back to? Your nervous system does. Your muscle tone is regulated through your brainstem, the primitive part of your brain, and spinal cord reflexes, and the autonomic nervous system, which regulates rest and relax, fight or flight. And if your system is living in chronic bracing, hey, Pico, he's looking for snakes. If your system is living in chronic bracing, what I call like that green light reflex pattern, you may be in overdue, over effort kind of mode. Or if it's in a red light reflex where there's a fatigue, a collapse, the front of the body's overdoing, the tone will organize differently. And neither of them is wrong. They're both protective. But when the underlying state doesn't change, the tension wants to redistribute. So you release your shoulder, but there's an overall pattern. Now your hip takes on the load the next time. Or you calm down your back and now your neck's getting tight. And it's not failure. Again, it's adaptation of an interconnected system. And your body will always prioritize survival if it hasn't been heard and the issues that it's telling you about haven't been met. So how do you actually meet them? How do you change the pattern instead of just chasing the pain? So let's talk a little bit about temporary relief and true regulatory change of the body, right? So temporary relief identifies symptoms and it reduces local tension. And we think that that's a fix. We've been taught that. But true regulation of the nervous system, of the whole web that controls the tone, changes a system-wide view. Stretching a tight muscle may help, massage may help, strengthening may help. I'm not saying they don't. But if your nervous system is still living under the load of a perceived threat, whether it's physical or emotional or inflammatory or in your relationships, it will reestablish protection somewhere unless it gets the message it doesn't have to do that. So symptoms are often the visible tip of a very large iceberg of your regulatory system that's below the level of the water you can't see, but it is imbalanced. Pain and stress cycles tend to reinforce each other. Chronic inflammation, eating processed foods, eating late at night, always being under stress and on the go when you eat, being exposed to chemicals. Like, there's so many things that bring about inflammation, increases the overall system's sensitivity. So pain gets heightened and it moves around. It increases your guarding. And when you're tight, it decreases circulation. It's like, go ahead and make a fist for 30 seconds and hold that. And now do it for 5 minutes. And now do it for 5 weeks. You bet circulation is decreasing and the fascia becomes tighter on this side, and trying to open your hand over time becomes more and more difficult. So it creates these loops. So instead of asking, how do I fix one spot, we start wanting to ask, am I holding throughout my system, and what's it trying to protect me from, and what difference can I make? So let's try something simple, all right? Let's look at just a global scan. And we can tend to downplay the effectiveness of these things because they seem so simple, but they are powerful. And it's not trying to correct, it's deep listening. And that kind of deep listening, most of us didn't get as kids. When you can give that back to yourself, you can make all the difference for old trauma. It's like Wayne Dyer, one of my favorite teachers, would always say, it's never too late to have a happy childhood. But you have to learn to care for yourself and internalize these shifts. So, sit comfortably and allow your eyes to close or soften, and take a slow breath behind you. I want you to visualize your ribs expanding and widening out to the back and the sides. And as you inhale and widen, think about 3-dimensional, front, back, and sides. And when you exhale, let your exhale be twice as long as your inhale. Breathing 3-dimensionally like a hula hoop, expanding all directions. Exhale maybe through the mouth if that's comfortable, inhaling through the nose, twice as long on the exhale. And as you move from the awareness of your breath, keep breathing that way. Just notice inside. Is one shoulder higher? Or are you tightening your jaw? Feel your sit bones. Do you have weight more on one side or the other? More pressure or curling of the toes in one foot? Is your low back tense for no reason, or are you gripping your belly? No fixing, no straightening, just mapping. Now, aware of the body, very gently sway a few millimeters to one side, very small. Let your nervous system feel weight shifting. Another just slow breath, long exhale. And go side to side. And notice as you do it, what softens. Let it go front to back. Pain often lives where your ability to move has decreased or stopped. And when you mindfully reintroduce breath and very small movement, the system has to soften to your conscious direction. It's like the primitive brain goes, oh, you're finally here paying attention. You're listening to me. It's used to not necessarily being heard. And when you give it that kind of attention, your more developed brain, your cerebral cortex, overrides primitive reflexes in your spinal cord and your midbrain. So, gentle sway, noticing areas of tension, noticing patterns of tension, and without trying to fix it or berating yourself or wishing the pain would go away, just noticing. And if something softened, even subtly, let me know what you notice. This lens is very helpful. It's very compassionate. So if you're loving this, please subscribe so you don't miss future episodes. And we're going to keep going with the series. Because our pain communicates a load that our body's having. This area of mind has been carrying too much for too long. And sometimes the load is just biomechanical. It's from stress and strain within the muscles and the tissues. But often it's kind of a stress physiology. Your immune system shifts, your hormones are disrupted, you have unprocessed overwhelm, and simply too little time to recover before the next thing hits you. And when we try to fight pain aggressively, we override the message. This is why I say over and again, physical therapy should not be painful. When you listen, when you allow the body to tell you that something is useful instead of painful, instead of forcing areas to let go, you increase global awareness of safety. And safety changes the tone of the body. Breathing again in the low back ribs, lengthen the exhale. When breath deepens, inflammation actually decreases. And then start to think about more hydration, better sources of food, eating earlier in the day, letting yourself go longer periods, cleaning up the trash, the junk in your body without eating. Your interoception, your internal sense of yourself begins to clarify. And that changes your muscle tone. You reset the dial within your body. You are not broken. Your nervous system has been protecting you. So this week, instead of chasing one sore spot into the next one, try to zoom out and kind of scan yourself. Breathe three-dimensionally. And add a small variability, way that you don't normally move. Gentle spirals is usually a really good one. And go slowly. Restore rhythm, lengthen your exhale. And ask your body, what are you protecting? What would actually feel safer for you? When you regulate before you try to renovate, the pattern within the body changes. Your clarity comes back online. Your body starts to make sense and it relaxes with your attention. If this resonated, go ahead and hit the like, do the thing, help out a sister. Soften before you strive. Safety first, change second. You are not broken. You are protecting. And the body is wise. Thank you, guys. See you next time.